Hi guys, in this video I'm going to explain in detail about the various treatment parameters of ultrasound, physiological and therapeutic effects as well as dangers and your treatment guidelines for therapeutic ultrasound. So coming to the treatment parameters includes your intensity, mode, frequency, treatment duration. That means how long you need to give treatment for this particular patients, and pulse mark space ratio, beam non-uniformity ratio, and what are the dosages that can be given to the different patients according to the severity of the conditions. The first one is your intensity. So intensity is selected according to your treatment goal. So whether the goal is to increase your tissue temperature or whether the goal is to just treat your soft tissues, so the intensity will be varying. So when the goal is to increase the tissue temperature, the patient should feel some warmth within 2 to 3 minutes of initiating the ultrasound applications and should not feel increased discomfort at any time during the treatment. So in order to, if the goal of the treatment is to increase the tissue temperature means, so the patient should feel the warmth within 2 to 3 minutes, but it should be a comfortable warmth rather than a discomfort. So when 1 megahertz frequency ultrasound is used, an intensity of 1.5 to 2 watts per centimeter will generally produce these effects. So our goal is to increase the tissue temperature, and if you are using 1 megahertz, that is a deeper penetration frequency, the intensity should be 1.5 to 2 watts per centimeter squares. And if you're using 3 megahertz, that is for your superficial conditions, if you're using 3 megahertz means an intensity of 0.5 watts per centimeter square is enough in order to produce a heat or a tissue temperature, increased tissue temperature. So for acute and immediate post-traumatic cases, we will be using 0.1 to 0.25 watts per centimeter square. And for chronic and scar tissues, we'll be using 0.25 to 1 watts per centimeter square. So coming to the mode, next parameter is your mode. So there are two modes in ultrasound, continuous mode and pulse mode. So continuous means there will not be any interruption or rest period in between. So that is a continuous mode. So continuous mode produces more heat. So it is used for musculoskeletal conditions such as muscular spasm, joint stiffness, pain, etc. If the patient is having any muscular tightness or muscular spasm or any joint tightness or joint stiffness, or the patient is having any pain means we will be using the continuous mode. So this continuous mode will be giving ultrasound rays at a continuous way and without any interruptions or without any rest period. So that is known as continuous mode, and that will be producing more heat comparing to the pulse mode. So pulse mode produces less heat, so it is used for soft tissue repair. Example, tendinitis. So inflammatory conditions or any soft tissue issues, we can give this pulse mode. So for deeper penetration, we will be using continuous mode, that is muscle spasm or joint stiffness, pain, joint tightness, etc. We'll be using continuous mode that will be having that will be producing more heat, and pulse mode will be producing less heat comparing to the continuous mode since we are giving in a pulse manner. So for example, 0.5 watts per centimeter pulse at 1:4 ratio deliver the same energy as 0.1 watt per centimeter square on a continuous mode. So in continuous mode, we are giving in intensity of 0.1 watt centimeter square, that is equal to pulse mode of 1:4 ratio of 0.5 watts per centimeter square intensity. We can give in different manner. So this is the continuous ultrasound. In this you can see the intensity. There is a continuous flow of ultrasound waves. So in this pulse ultrasound, you can see this is the ultrasound wave intensity, and this is the rest period in between the different ultrasound waves. So coming to the another diagram, this is the ratio of on or off time, that is the duty cycle actually. So this happens during the pulse ultrasound. So continuous also having duty cycle, that will be 100%, And in pulse ultrasound, the duty cycle will be varying, depends upon the time of respite or off time. So this is where the ultrasound waves will be passing, and this is where ultrasound waves will not be passing. That is the respite. So the ratio of on to off time is your duty cycle. So in continuous ultrasound, the energy is constantly being generated. So ultrasound energy will be constantly generated without any rest period or off time in between. So this is the continuous ultrasound diagram. So the duty cycle will be 100%. And coming to the frequency is selected according to the depth of the tissue to be treated. So for tissues up to 5 centimeter depth, you can use 1 megahertz. For tissues up to 1 to 2 centimeter depth, you can use 3 megahertz. For example, if you want to treat any joints or bone conditions or fracture healing, in order to facilitate your fracture healing, you can use 1 megahertz. So that means almost 5 centimeter, 2 inches deep depth means you need to use here 1 megahertz frequencies. So 1 megahertz means 1 lakh cycle per second. And for tissues, superficial cases, we can use 3 megahertz. So for deep cases, you need to use 1 megahertz, and for superficial cases, you need to use 3 megahertz. The depth of penetration is lower in tissues with high collagen content and in areas of increased reflection. The penetration, so in the previous video, we already discussed about the properties of ultrasound, reflection, and all. So the depth of penetration will be depending on the content of the connective tissues. If the tissue is having higher collagen content, then the depth of penetration will be lower because they will be reflecting back. So for bone cases, so this is the diagram, 1 megahertz and 3 megahertz. So in 1 megahertz can penetrate deep up to 5 centimeters, that is 2 inches. So it can even treat your bone conditions as well as your deeper connective tissues conditions. So you can treat your joints also. For 3 megahertz, you can use only for your superficial conditions. So coming to the duty cycle is selected according to the treatment goal. When the goal is to increase the tissue temperature, a 100% duty cycle, continuous duty cycle should be used. When the goal is to produce the non-thermal effects, pulse ultrasound with a 20% or lower duty cycle should be used. So again, the duty cycle, so we already discussed. So in continuous mode, they will be having 100% duty cycle, and in pulse ultrasound, they will be having less than 100% of duty cycle. Depends upon the amount of ratio of on and off periods. Sometimes 20%, sometimes 40%, or sometimes 60%, sometimes 80%. Depends upon the effect we need. So for if our goal is to increase the tissue temperature, we need to use the continuous ultrasound, continuous mode ultrasound, which will be having 100% of duty cycle. And if the goal is to produce a non-thermal effects, we can use pulse ultrasound with a 20% or less percentage of duty cycles. So coming to the pulse mark space ratio, when an ultrasound is applied in its pulse mode, the ratio of on time to off time should be expressed. So the pulse mark space ratio is, if you are using a pulse mode ultrasound, the ratio of on time to off time, so that is known as pulse mark space ratio. So this is the mark space ratio, the mark being the time the ultrasound on, and the space being the silence, or both being measured in milliseconds. So pulse means the ratio of on, and the space means the ratio of on. On is to off ratio, that is pulse mark space ratios. Some units have a single fixed mark space ratio of 2:8, whereas others have a variable range. For example, 1:1, 1 second on, or 1 millisecond on, 1 millisecond off. 1 millisecond, 1:4, that is 1 millisecond on, 4 milliseconds off, or 1:7, 1 milliseconds of on, 7 milliseconds of off. So this is, it depends on, it varies according to the machines. Next parameter is here, beam non-uniformity ratio. The beam non-uniformity ratio is the ratio of spatial peak intensity to the spatial average intensity. For most units, this is usually between 5:1 and 6:1, although it can be as low as 2:1. Using a transducer with a maximum beam non-uniformity ratio of 5:1, when the spatial average intensity is set at 1 watt per centimeter square, the spatial peak intensity within the field could be as high as 5 watts per centimeter square. So this is the ratio of spatial peak intensity to spatial average intensity. Using a transducer with a maximum beam non-uniformity ratio of 6:1, when the spatial average intensity is set at 1.5 centimeter square, the spatial peak intensity within the field could be as high as 9 watt per centimeter square. So 6:1 ratio. So you can see 1.5 into 6, that is equal 9 watts per centimeter square. So spatial next parameter is your spatial average intensity. So the average intensity of the ultrasound output over the area of the transducer. Next parameter is your spatial peak intensity. So the peak intensity of the ultrasound output over the area of the transducer. So usually in the next slide we can able to see the diagram. So the intensity is usually greater at the center of the beam and lowest at the edges or periphery of the ultrasound beam. So in this diagram, you can able to see this is the transducer and this is the effective radiating surface area. In this, it is almost the spatial peak intensity will be more at the center of the ultrasound beam, and the spatial peak intensity will be getting less as it moves towards the periphery or edges of the ultrasound beam. So this is the beam non-uniformity ratio, the ratio of spatial peak intensity with the spatial average intensity. So next parameter is your spatial average temporal peak intensity and spatial average temporal average intensity. The coming to the first intensity, that is spatial average temporal peak intensity. So this is the spatial average intensity of the ultrasound during the on time of the pulse. So this is a measure of the amount of energy that is delivered to the tissues. Clinical ultrasound units generally display the spatial average temporal peak intensity when pulse ultrasound is applied. And next parameter is your spatial average temporal average intensity. The spatial average intensity of the ultrasound average over the on time and off time of the pulse. So spatial average temporal average intensity is equal to spatial average temporal peak intensity for continuous ultrasounds. So for pulse ultrasound, this spatial average and temporal peak intensity will be there. So this is the diagrammatic representation of the spatial average temporal peak intensity and spatial average temporal average intensity. So spatial average temporal peak intensity into duty cycle is equal spatial average temporal average intensity. So for example, if the spatial average temporal peak intensity is equal 1 watt per centimeter square, and with the in duty cycle that is 20%. So in pulse ultrasound, so this is the pulse ultrasound mode. So you can see 20% duty cycle. So 1 into 0.2, that is the spatial average temporal average intensity will be 0.2 watts per centimeter square. And this is the pulse ultrasound, and this is the continuous ultrasound. So in continuous ultrasound, spatial average temporal peak intensity and spatial average temporal average intensity will be same. So for example, the spatial average temporal peak intensity is 1 watt per centimeter square, and in continuous mode we will be having 100% duty cycle. So 1 into 1. So the spatial average temporal peak intensity and spatial average temporal average intensity will be same, that is 1 watt per centimeter square each. So this is the same diagram, spatial peak intensity and spatial average intensity. Spatial peak intensity will be higher at the center and it will be lesser as it travels towards the edges of the ultrasound beam. And this is the diagrammatic representation of the duty cycle. This is the 2 duty cycles for a pulse ultrasound. So 2 milliseconds of on period and 8 milliseconds of rest period. So that is known as 20% duty cycle, and 50-second duty cycle means 5 milliseconds of on of ultrasound on period and 5 milliseconds of off period. So the ratio of on and off period is known as your duty cycle. Coming to the duration, the treatment duration is selected according to the treatment goal, the size of the area to be treated, and the effective radiating surface area of the sound or ultrasound head. For most thermal or non-thermal applications, ultrasound can be applied for 5 to 10 minutes for each treatment area, that is twice the effective radiating area of the transducer. For example, when an area measuring 20 centimeters square is treated with an ultrasound head that has an effective radiating surface area of 10 centimeters square, the treatment duration should be 5 to 10 minutes. So usually we will be applying for nearly 8 minutes. That is the normal protocol. But the protocol will be different according to the different conditions as well as different areas which you're gonna treat and different methods of application as well. When an area of 40 centimeters square is treated with the same effective radiating surface area of 10 centimeters square, the treatment duration should be extended to between 10 to 20 minutes. So 20 centimeters square with an effective radiating area of 10 centimeters square means 5 to 10 minutes enough. 40 centimeters square area with effective radiating surface area of 10 centimeters square, the treatment duration should be almost double, that is 10 to 20 minutes. When the goal of treatment is to increase the tissue temperature, the treatment duration should be adjusted according to the frequency and intensity of the ultrasound. For example, if a goal is to increase the tissue temperature by 3 degrees Celsius, that is 37 degrees Fahrenheit, and thus reach the minimal therapeutic level of 40 degrees Celsius, that is 104 degrees Celsius, 100 degree Fahrenheit. So if 1 megahertz ultrasound is at an intensity of 1.5 watt per centimeter square is applied to an area, twice the effective radiating area of the transducer, the treatment duration must be at least 9 minutes. Whereas if the intensity is increased to 2 watts per centimeter square, the treatment duration need only 8 minutes. So the goal, if the goal is to increase the tissue temperature, there are two parameters that we need to focus: frequency and intensity. So if the higher frequency is used, the intensity will be the duration, like if higher frequency like 1 megahertz is used at an intensity of 1.5 watts per centimeter square, the duration should be around 9 minutes. But if you're increasing the intensity with the same frequency, the duration will be getting less. And if the 3 megahertz ultrasound is used at an intensity of 0.5 watts per centimeter square, the treatment duration should be at least 10 minutes to achieve the same temperature level. So it all depends upon the frequency and intensity of the ultrasound. And in general, the treatment duration should be increased when lower intensity or lower frequencies of ultrasound are used, whereas the larger area than the twice the effective radiating area of the transducer are treated, or when high tissue temperatures are desired. Normally the treatment duration should be increased, depends upon the frequencies as well as the size of the treatment area which you are going to treat. And the treatment duration should be decreased when higher intensity of frequencies are used, when areas smaller than twice the effective radiating surface area of the transducer are treated, or when lower tissue temperature are desired. So the treatment, it depends upon the intensity, frequency, and whether the effective radiating area, whether it is twice or less than twice the area is going to be treated. And when the ultrasound is used to facilitate bone healing, longer treatment times of 15 to 20 minutes are recommended. So our goal is to achieve or facilitate the bone healing or fracture healing. In those cases, we can give this ultrasound, mainly that 1 megahertz ultrasound, for 15 to 20 minutes for longer duration. And coming to the dosage, 3 factors which determine the ultrasound dosage are as follows: size of the treatment area, depth of the lesion from the surface, and nature of the lesion. So dosage in acute lesion or conditions or acute cases. In acute cases, treatment applied cautiously to prevent the exacerbations of symptoms. Initial stage, we will be using the low dosage, that is 0.25 to 0.5 watts per centimeter square, and for 2 to 3 minutes. Progression unnecessary if condition improves. In failure cases, 0.25 to 0.5 watts per centimeter square for 4 to 5 minutes, or 0.8 watts per centimeter square 2 times for 2 to 3 minutes. Aggravations of symptoms is not always a bad sign, as it may indicate repair process are taking place. During that situation, a reduction in dose in both time and intensity may be indicated, or treatment with ultrasound may be deferred until the symptoms subsides to their original level. So if there is any symptoms exacerbating means we need to reduce the dosage or we need to stop this treatment until these symptoms get subsides. It may also possible to select different Mark's pulse ratios and use 1:7 for very acute and 1:1 for less acute. And dosage in chronic conditions. Chronic conditions may be treated with pulse or continuous mode. The maximum intensity of ultrasound which should be used is that which produces the mild perceptible warmth. This usually occurs around 2 watts per centimeter square. Initial low dose is tried. Initially, we need to use the low dose and intensity 0.8 watts per centimeter square for the 4 minutes. If improvement occurs, then treatment is repeated. If no improvement occurs, dose is gradually increased. So first we need to start from the low dose. Then if there is no improvement, we need to progress with the higher doses. And maximum dose of ultrasound should be 2 watts per centimeter for 8 minutes. So this is the case for chronic cases. And the important point is if there is no improvement for around 6 sittings, ultrasound treatment is not effective for that particular patient or person. So we need to discontinue the ultrasound treatment and we need to use another modalities or another technique for which is suitable for that particular patient or person. And progression and timings, that is frequency of treatment. Recent injuries and acute conditions, we can use 1 or 2 times per day. And chronic cases, we can use alternate days. So every alternate days. And effective radiating area. So the area of the transducer from which the ultrasound energy radiates. So this is the effective radiating area. And because the crystal do not vibrate uniformly, the effective radiating area is always smaller than the area of the treatment head. And the size of the effective radiating area that can be treated with the ultrasound depends on the effective radiating area of the transducer and the duration of treatment. So a treatment area equal to twice the effective radiating area of the ultrasound head can be treated in 5 to 10 minutes. So the total duration of the treatment is also depending upon the effective radiating area. If the effective radiating area are equal to twice if the treatment area is equal to twice the effective radiating area, so we can give this particular treatment or ultrasound treatment for 5 to 10 minutes. So this is the effective radiating area and this is the transducer phase. So this effective radiating area is the area through which ultrasound waves passes. So this area, there will not be passage of ultrasound waves. Small areas can be treated in proportionately shorter times. However, it is impractical to treat areas measuring less than 1.5 times the effective radiating area of the sound head. So, and still keep the sound head moving within the area. So, if you are taking some cases, so the effective area, at least the treatment area should be 1.5 times the size of the effective radiating area. So, larger areas can be treated proportionally longer times. However, the ultrasound should not be used for treating larger areas. That is 4 times the effective radiating, 4 times the size of the effective radiating area of the transducer, such as the whole back. So, because this requires excessively long treatment durations, and when heating is desired, the results in some areas being heated, while other previously heated areas are already cooling. So, we should not use for broader areas like 4 times greater than the size of the effective radiating area, and we should not use less than 1.5 times the size of the effective radiating area also. So the area between 1.5 times to 4 times the size of the effective radiating area can be used. And coming to the number of treatments, the recommended number of treatment depends on the goals of the treatment and the patient's response. If the patient is making progress at an appropriate rate towards the established goals for this intervention, the treatment should be continued. If the patient is improving means we can continue with this ultrasound treatment. And if the patient is not progressing appropriately, the intervention should be modified by changing the ultrasound parameters or by selecting a different interventions. And if there is no improvement in this around 6 to 7 sittings, we should definitely discontinue this ultrasound treatment and we need to give some alternate modalities or treatment techniques. And in most cases, an effect should be detectable within 1 to 3 treatments. For problems in which progress is commonly slow, such as chronic wounds, or in which progress is hard to detect, such as fractures, the treatment may need to be continued for a longer period. So this is the formation of standing waves. Coming to the physiological effects. So there are two types of physiological effects. One is thermal effects and next is non-thermal effects. Thermal effects includes elevated tissue temperature. Your tissue temperature will be getting elevated. Blood flow will be getting increased. Increased tissue extension, the soft tissue extensibility or the connective tissue extensibility will be getting increased after application of ultrasound. Local metabolism will be increased and there will be alteration in the nerve conduction velocity also. So these are the thermal effects. And what are the non-thermal effects includes your cavitation, fluid movement, increased cellular membrane permeability, acoustic microstreaming, stimulation of the fibroblastic activity, mechanical effects of micromassaging effect, and biological effects. So there are two physiological effects, thermal effects and non-thermal effects. So first one is your thermal effects. There will be a local rise in temperature could be used to accelerate the healing. The extensibility of the collagen is increased by rising temperature, and so stretching of the scars or adhesions is easier following the ultrasound. The thermal effect may also be helpful for reducing the pain. Coming to the non-thermal effects, first one is your cavitation. This is the oscillatory activity of highly compressible bodies within the tissues, such as a gas or vapor filled voids. Cavitation may be either stable or unstable. So unstable cavitation is one of the danger of the ultrasound. So stable cavitation occurs when the bubbles oscillate to and fro movements within the ultrasonic pressure waves but remain intact. It is not dangerous and could be of benefit as it modifies the ultrasonic beam in such a way they used to cause microstrain. Unstable or transient cavitation. This is the dangerous one. This occurs when the volume of the bubbles changes rapidly and then they will be getting collapsed. It is potentially dangerous to the tissues as the collapse of the bubbles cause a great local rise in temperatures. It is avoided by moving the treatment head, using a low intensity and using a higher frequency. So if you're treating and if you're not moving means you may lead to burns. So that is mainly because of the formation of these unstable or transient cavitations. And that is the reason, that's the reason why we always used to treat in a circular or figure of eight or like that. So we used to move the ultrasound head in a systemic manner. So in order to avoid these burns as well as your unstable cavitation, which is one of the danger of ultrasound treatment. Next effect is your microstreaming effect. Microstreaming is a unidirectional movement of fluids along the boundaries of the cell. Due to microstreaming, permeability of the cell membrane and direction of movement of molecules into the cells is influenced. So this is the cavitation and microstreaming. So this is the stable cavitation, that is to and fro movements, and this is the unstable cavitation. In this unstable, the bubbles will be getting broken and it may lead to burn of that particular area which you are going to treat. Unstable cavitation mainly occurs as a result of if your ultrasound head is not moving properly means this unstable cavitation will be occur. Next physiological effect is your mechanical effect or micromassaging effect. This occurs when the longitudinal compression waves of the ultrasound beam produces compression and rarefaction of cells and affect the movement of tissue fluid in the interstitial spaces. This can help in reducing the edema. Combined with the thermal effect, the extensibility of scars and adhesions could be affected in such a way to make stretching them easier. It is also possible that the mechanical effect could help reduce pain. So the mechanical effect or micromassaging effect mainly occurs because of the longitudinal compression and relaxation, alternate compression rarefaction of the ultrasound waves. So thereby it may lead to movement of the excessive interstitial fluids into the interstitial space. Thereby it will be helpful for reducing the edema as well as it may helpful for reducing the pain. So next physiological effect is your biological effect. Ultrasound can have some useful effects in all the three stages of repair. First stage is inflammatory, second stage is proliferative, third stage is remodeling. So in first stage, the ultrasound probably increases the fragility of lysosome membrane and thus enhances the release of their contained enzymes. These enzymes will help to clear the area of debris and allow the next stage to occur. So cleaning process will be mainly facilitated by the application of this ultrasound, which will release these enzymes. Next stage is your proliferative. Fibroblasts and myofibroblasts may have calcium ions driven into them by the ultrasound. This increases their mobility and encourages their movement towards the area of repair. The fibroblasts are stimulated to produce the collagen fibers to form the scar, and myofibroblasts contract to pull the edges together. So this, because of the application of this ultrasound, fibroblasts and myofibroblasts will be helpful for tightening or pulling the edges of the wounds together. That may help in repairing of the wound. And next stage is your remodeling. The ultrasound has shown to increase the tensile strength of the scar by affecting the direction, strength, and elasticity of fibers, which make the scar easier. So all these stages, ultrasound have some particular effects. So coming to the basic therapeutic applications, either you can use as non-thermal effects, as thermal effects as well. So non-thermal effects you can use for your acute injury, edema, healing purposes and all. And thermal we can use for subacute chronic inflammation trigger points and in order to stress the connective tissues. And coming to the therapeutic effects, the first therapeutic effect is pain reduction. Next is your scar tissue management, chronic indurated edema, varicose ulcers, bone injuries, plantar warts, placebo effects. So first therapeutic effects is pain reduction. So heat produced by the ultrasound in large diameter nerve fibers may reduce the pain gauge through your pain gauge mechanisms. Next is scar tissue management. Scar tissue is made pliable by the application of the ultrasound, which allows more effective stretching of the contracted scars. Next is chronic indurated edema. These mechanical effects of ultrasound have an effect on chronic edema and help in its treatment. It also breaks down the adductions formed between the adjacent structures. So this is the treatment for ultrasonic treatment for your wound healing. We used to apply over the periphery of the wound, which will enhances all the fibroblasts and myofibroblasts that may helpful for stretching the scar tissues, as well as it may pull the wound tissues together, which will enhances the wound healing. So this is for your posterior knee tightness. Ultrasound can be used, which may helpful for reducing the soft tissue tightness, or it may improve the stretchability of the soft tissues or connective tissues. So next is for your varicose ulcers. Ultrasound is found effective to promote the healing of varicose ulcers and pressure sores. Next is bone injuries. Ultrasound in the first and second week after bone injury can increase the bone union, but given to an unstable fracture during the phase of cartilage proliferation, it may result in proliferation of cartilage and therefore decrease in the bone reunion. Next is it can use also for plantar warts treatment. These are the different applications, and this is the diagrammatic X-ray representation of the fracture healing. So this is the ultrasound application. This is one patient in which they had given ultrasound treatment, and this is another patient in which they didn't give ultrasound treatment. So you can able to see the difference. Both are 17 days post-operative X-ray. So in this patient, you can see the healing has taken tremendously than comparing with the patient who didn't take ultrasound treatment. And placebo effect, while the physiological effects of ultrasound have been discussed, it can also produce some therapeutic psychological effects. So even though we are not using the ultrasound, we didn't switch on the ultrasound, but the patient may have some psychological benefits, saying that this after this ultrasound application, they are having some improvements. So like that, it is not only producing a physiological effects, it also produces some psychological benefits or psychological effects to the patients. And coming to the guidelines for the safe use of ultrasound equipments, the following treatment guidelines will help to ensure the patient safety. So first we will be questioning the patient, do you have any contraindications like that? We will be asking whether this patient is having these issues or like that. And after that, after asking this question to the patient regarding a contraindications or any previous issues, first we will be positioning the patient, and the positioning should be comfortable to the patient as well as to the therapist. Next, we need to inspect the area which we are going to treat, whether there is any rashes or infections or open wounds. So we need to check the area where you are going to treat. And next step is to obtain the appropriate sounded ultrasound head size. And next step is to determine the frequency. So if the patient is having any issues within the joint, we need to use the 1 megahertz, or deeper cases, we need to use the 1 megahertz. And soft tissues, sprain or strain like that, we can use, or any other inflammatory conditions also over the superficial area, we can use the 3 megahertz. And we need to set the duty cycle. So 100% duty cycle for continuous ultrasound, and 22 means it depends upon the duty cycle for pulse ultrasound. And we need to apply the coupling to the area, and so we need to set the treatment durations. So if our goal is to increase the tissue temperature, we need to give 5 to 10 minutes. For the chronic case and chronic cases of fracture healing, we can give up to 15 to 20 minutes. And maintain the contact between the skin and the applicator. So move at the rate of 4 centimeters per second for two times the size of the effective radiating area. We need to adjust the intensity to perception of heat. If this gets too hot, turn down the intensity or move applicator slightly faster. If the goal is increased range of motion, put the part on stretch for the last 2 to 3 minutes of insonation, and maintain the stretch or friction massage 2 to 5 minutes after the termination of treatments. And we need to stop the treatment, and we need to turn all the dials or all the dials to 0, and we need to clean the gels from the unit, and we need to assess the treatment efficacy, inspect the area, feedback, what are the feedback you are getting from the clients. We will be asking, are you okay, and is there any improvement like that than the previous before treating? Is there any particular benefit you are getting or any improvement you got, like that we need to ask. And we need to record the treatment parameters, and later just we need to take another, we will be instructing to take another appointment for the next day. So these are the guidelines of ultrasound treatment. And coming to the dangers, first danger is your burns. If the continuous ultrasound beam is used and is allowed to remain stationary, excess heat can accumulate in the tissues and eventually lead to burns. However, the danger of burn is effectively eliminated by keeping the ultrasound head moving, using pulse beams, and avoiding bony prominence if possible. Next danger is your cavitation, especially your unstable cavitation, which is dangerous. Next is your overdose. Excessive dose may cause an exacerbation of symptoms. It may either lead to burn as well as. Next one is danger to the equipment. If the ultrasound head is held in the air while switch on, the reflection of the beam back into the treatment head may set up standing waves, which could damage the crystals. Consequently, the head is never turned on unless it is contact with the transmitting material. So whenever you are going to treat, we should not keep the ultrasound machine on with the ultrasound head in the air. So always keep the ultrasound head in the patient's treatment area, and you need to keep moving. At the same time, you need to switch on the machine or increase the intensity. If the intensity has been increased and you are keeping in the air, means it may lead to formation of standing waves, and this reflection will be getting back to the ultrasound head again, and it may lead to the damage of crystals, because air is not a conductor of this ultrasound waves. So coming to the precautions for the use. So precautions include acute inflammations, epiphyseal plates, fractures, breast implants. And this is the decision making chart. So if the patient is having a soft tissue shortening, we need to use the thermal effects, and that means in order to produce thermal effects, you need to use the continuous ultrasound. So that will be 100% of duty cycle. And if the patient is having like that means 1 to 2 centimeters superficial problem issues means you can use the 3 megahertz at 0.5 watts per centimeter square. If the patient is having uh, deeper issues or within the joint or bone means bone contusion or any joint inflammation means you need to use this 1 megahertz ultrasound head, and that will be having high intensity, that is 1.5 to 2 watts per centimeter squares. So this is the thermal effects if our goal is to increase the tissue temperature, and if our goal is to just stretch the soft tissues or reduce the healing or increase the healing or to reduce the inflammation means we can go for non-thermal, that will be in a pulse mode, that will be we'll be using 20% of the duty cycle. And again, if the issue is within the soft tissue superficial area means 1 to 2 centimeters, 3 megahertz we can use 0.5 to 1 watts per centimeter square. And if the issues deeper means in the joint or bone means we can use 1 megahertz, but the same intensity 0.5 to 1 watts per centimeter square. And the treatment area will be 5 to 10 minutes depending upon the effective radiating area. If the effective radiating area is, if the treatment area is twice the effective radiating area, we can use 5 to 10 minutes. It depends upon the area as well as depends upon the effects, whether you want a thermal effect or you want a non-thermal effects. And if you want thermal effects means you should go for continuous ultrasound. And if you don't need a thermal effect, if you want just non-thermal effects means you can go for pulsed ultrasound. So by this, we are concluding this video of ultrasound. And the next video will be coming with another electrotherapy modalities. Thank you for watching this video. Please do subscribe and share this to your friends and physio fraternity. Thank you.